Disordered Eating by Peyton Hill. Anybody can be affected by an eating disorder, and a lot of times they are a silent disorder that goes either undiagnosed or is very hard to be treated. They are a very prevalent disorder in our society today, and there's a lot of things that can be done to prevent disordered eating and also have proper treatment. There are many different types of eating disorders. Three of the most commonly diagnosed disorders include anorexia nervosa, which includes people viewing themselves as overweight even if they are thin. It has a lot of distorted body image and body view of themselves. They avoid specific foods and they even experience some restricted eating. Bulimia nervosa, which is when people tend to eat large amounts of food as a way to make up for lack of calories that they didn't eat during the day. This can have people not being able to control themselves and what they eat. People tend to take laxatives, vomit, or fast excessively, or exercise often after large amounts of food as a way to counteract the amount of food that they ate. And a third common eating disorder is binge eating disorder, where there is lack of control over the binge eating and it comes with feelings of distress or guilt after consumption. This is just to name a few eating disorders. People go through a lot of different ones and they don't even all have a name. Some signs and symptoms of an eating disorder can include lack of sleep or poor sleeping patterns, chronic dieting, weight fluctuation, a fixation with food, depression or tiredness, and sometimes isolation. Because every eating disorder is different, people all experience different signs and symptoms of an eating disorder, but the main idea of these signs and symptoms is that it's a lot of things that people go through on a daily basis, and they might not see it as implications as indicating an eating disorder, but they are very silent at times and can happen to anyone. Eating disorders are very prevalent in society. They are more commonly diagnosed in women than they are in men, and according to the chart, it is able to be seen that the most eating disorders are diagnosed in people ages 12 through 25. This means that a lot of people are diagnosed while they're going through either junior high or middle school, high school, even all the way up to college. A lot of these people experience these as a result of peer pressure or how society makes them feel about their bodies, and they even have a tendency to reflect those things onto themselves. So they are very prevalent in society, and it's sad to see that they're diagnosed in younger individuals when they're not even done growing and developing in their bodies yet. Eating disorders have a lot of different implications and side effects that come along with them. Physical health risks of eating disorders include heart problems, hormone disruption, problems with their digestive systems, weakening bones, or electrolyte abnormalities. They have the ability to disrupt and have long-lasting effects on a lot of the body systems, including cardiovascular, nervous, and endocrine systems. Sometimes an eating disorder can even lead to tooth decay as a result of people attempting to make themselves vomit as a way to get rid of their calories or whatever food they just ate. And tooth decay is a very common thing that people go through after having an eating disorder. Gastrointestinal issues are also something that people with an eating disorder can go through, and these issues include stomach pain, bloating, and sometimes even infection of specific organs in the gastrointestinal system. It can also include wear down of the esophagus. As previously mentioned, some people make themselves throw up as a way to get rid of some calories that they ate before in the day, and the excess of vomiting can cause a lot of problems to different systems in the body. Individuals that go through eating disorders also have other mental effects like depression or anxiety. The cause for these mental illnesses can be from thoughts that they think about themselves, or sometimes based on what others think of them. Some other mental effects of eating disorders can be substance abuse, self-injury, and in severe cases, OCD. People have the ability to become obsessed about numbers, whether that being how much they weigh, how many calories they eat, or anything relating to food or their body image. And this gives them a very distorted sense of self, and they're making themselves seem like only the number matters rather than their character. And this has the ability to greatly affect a person's brain and how they think about themselves and even how they view others. Effects from society. Societal influences like social media or pressure or judgments from peers or friends at school have the ability to impact one's sense of self and their body image. Genetics, peers, environment, and emotional health are all social effects on eating disorders. People have the ability to experience pressure from society's standards, and sometimes people even see apps like Instagram or Snapchat and they see how much a person alters the way that they look. And these give people unrealistic standards and unrealistic expectations of how their body can look. They have the ability to make people think that they need to look the way that a famous person does on social media, and this can sometimes trigger or cause people to think about their food intake or any of their intakes even more. And society has a very big pressure and ability to affect people in an eating disorder. It can trigger one to start, or if a person is struggling through one, I think that society has the ability to greatly influence people. Treatment for eating disorders is a team effort and could need assistance from nutritionists, primary care providers, counselors, family, and friends. It includes long-term psychological, biological, interpersonal, and cultural forces. Counseling, sometimes medication, and support groups are also needed during treatment for an eating disorder. In severe cases, treatment leads to hospitalization. Eating disorder prevention. Different prevention strategies are used to help reduce the amount of eating disorders. These can include universal prevention, which regards eating disorders on a global or national level, selective prevention, which can focus on a specific group or set of people, and targeted prevention, which is more of a personalized form of care. All of these prevention strategies are very important and should be talked about in our society today. As previously mentioned, eating disorders aren't commonly discussed. This can cause them to go misdiagnosed or people to not get the treatment that they need. They should definitely be treated as a public health issue, and awareness should be something that is high on a priority list. Public health officials should step up and realize that eating disorders are a very serious thing in our society today, and I think that prevention is something that is vital for individuals going through an eating disorder or people struggling with their body image or self-image.